Hello, I'm Dr. Deborah Braboy with Anchored Hope Counseling. Welcome to our YouTube program, Hope Talks. We have some great content provided by our amazing counselors, and we hope that you find it helpful. Hello, and welcome to another episode of Hope Talks. I'm here with Michelle Pass. She's a licensed marriage and family therapist and a licensed professional counselor. And I'm Dr. Deborah Braboy, licensed professional counselor here at Anchored Hope Counseling. So today we're just going to talk a little bit about just different interventions and things that we do with children. So we get phone calls often from parents and even pediatricians who are looking to recommend little kids who may have anxiety or some behavioral issues or some depression or things like that they're noticing, and they want to refer. Often they ask, what's the youngest age that you'll see somebody, and what's the youngest that you work with?
I think the youngest I've had probably is like 4, sometimes under that. They say play therapy is like 3 to 12 is the average age that they use, but I think some of it just really depends on the individual themselves and kind of where they're at, you know. Right.
And so you've had some additional training in play therapy for working with children.
Yes.
I've had a seminar or two, not a whole lot. And I typically go down maybe 6. I think I've had some around 5, but I don't typically go much younger than that. Yeah. So what kind of things are kids presenting with that you would do play therapy, or maybe art therapy, or sand tray therapy, or we can even kind of talk about each of those a little bit, the different modalities?
Okay. Kids present for a variety of different reasons. So we've seen them, they're getting referred like from their schools, they're having behavioral problems, you know, maybe like some ADHD or defiance, and like autism spectrum disorder, so maybe they're needing some help with social skills, things like that, just really being able to pick up how they're interacting with their peers, how to regulate emotions, learning boundaries, you know, with kids. So I think there's a lot of different things. Also, trauma, you know, kids that have experienced traumatic events, divorce, separation, you know, several just life issues. You know, kids really experience everything that adults do. It's just how they respond or interpret things is a little bit different. So some of the reasons the kids may present for counseling, we've had maybe parents are divorcing, some separation anxiety issues, bullying, you know, at school, or just maybe ADHD, impulse control, you know, being able to focus and pay attention. So maybe teaching them some skills that can help them just be a little bit more successful in school.
I've even seen too some children that maybe they didn't even go to daycare, and so they haven't really had a whole lot of exposure to peers. So sometimes they may struggle with you know, knowing how to share and just social skills.
Yes.
So that's something I've seen people refer children for.
Yeah, definitely social skills, especially gosh. Yes. Yeah, social skills. I think kids present with a lot of the same issues as adults. It's just how they kind of interpret them or experience them. They've, you know, they're not as mature, that, you know, so they don't really understand things the way that adults do. So maybe how they react, you know, so I think play therapy is great because you can kind of look at them in their world.
Right.
And you kind of meet them where they're at.
Right.
Know.
Because they don't really have the cognition, and developmentally, they're not at a place where they can really kind of articulate what's going on for them. You know, they don't really have the ability to put words to what they're experiencing. So they just kind of know how they feel, and they really don't even know how they feel. A lot of times they come in and their you know, feelings vocabulary is super limited. They're mad, sad, or, you know, happy.
Yeah.
That's kind of it. So sometimes it's a matter of just helping them kind of learn how they feel when, you know, maybe they're frustrated or disappointed or sad.
Yeah.
So what are some of the things that you do with children when they come in? There's different modalities. We kind of mentioned sand tray, play art, things like that. Is there anything specific that you kind of go to? What's your favorite?
Oh, my favorite. I like art because it's fun and you get to see that creative side.
Yeah.
The kids, even the teenagers, love to do the art. Even some adults that like it.
Yeah.
I know I like the play. I think it just kind of depends on the kid. And so there's directive play therapy techniques where I've already met with like the parents and we have like specific goals that we want to work on. So I already have an idea in my head when they come in of like, this is what I'm going to use this tool and we're going to work on like teaching this skill or this goal. And then there's also like non-directive play therapy techniques so where they're guiding everything. And so they're leading and I'm just kind of following them and we kind of see where it goes. So both have really good value. It just depends on what kind of you're working on that specific.
Give me an idea of the non-directive. So what kind of things do you use with them when they're like kind of describe your office a little bit because you've got some fun stuff in there.
Yeah. So we've got the sand tray, we've got sand. I love like manipulatives, little neat stuff, you know, that they can play with. We have arts and crafts stuff, dolls, figurines, the houses, the kitchen and the food, just various different things. And so games. I love different board games and stuff that you can teach a lot of impulse control and patience and get them just to talk. I have like a thinking, feeling, doing game that I like to play with kids and sometimes with their siblings or their parents and bringing the whole family in to kind of do stuff. Sometimes parents don't know how to play with their kids, or kids don't know how to play. You know, so it's kind of neat to teach them in a way how to relax.
So you're doing a lot with parents and children together in there, and it sounds like maybe coaching the parent in how to help their child process.
Feel a little, play, and sometimes I'll bring them in, and because they want to know, like, what are you doing back there? Are you just playing?
Right.
How is that beneficial?
Right.
You know, so just trying to get them to understand, like, the importance of playing. Like you said earlier, they don't have the vocabulary, so it's kind of that's their words is through their play. So with the non-directive, we talked about maybe the dollhouses and the toys and the figurines, and so if you have all those out, you're really watching them. So I've seen kids, they'll play out fights that like their parents have had them at before.
Oh.
You know, so they'll have like a mom and a dad and the kids, and you'll be watching and observing. And you don't join in unless they invite you kind of into their world.
Sure.
But you'll see fights and people yell and leave the house and them locking the doors, and you know, they don't have that verbal like language to express it, but they're processing it and they're kind of working through these things that are going on in their life through some of that non-directive play. It's really interesting. Yeah. So they're communicating with you through their play. So the art, you said you love to do the art therapy. Kind of tell me more. I know you did it with grief.
I do. I use it a lot for grief, especially with teenagers. We call teenagers the forgotten mourners because they put on this facade like, I'm good, I'm really good. You can, deal with little siblings or my parents or something, but I've got it all together. And the truth is they don't, but they put forth that they do. So giving them a canvas or, some just like with the, younger children, of course you want to respect where they're at age-wise because they don't want to feel belittled and, who does, know. So, but giving them kind of that opportunity to kind of process, they don't want to feel like they're in the spotlight and being interrogated. So art really allows them to kind of get their feelings out without having to sit and talk about it, So there's a lot of different things. Sometimes they will paint on rocks. They like to do that. We'll do canvases, or they can even just kind of draw pictures of what their family looks like, and it's always interesting to see who's included and who's not. And so I like to use a lot of art with, especially with my grieving clients that are younger. It's really helpful. I mean, we did sometimes Santray also, but we can talk about Santray another time because we're about out of time.
Yeah.
So anything you can think of that's super important to kind of pass along about play therapy?
I think parents should try it for their kids. You know, if they have any questions, you know, I always like to meet with the parents first to kind of see what's going on and what kind of their goals are, concerns, or anything like that. But then also just not, like, I want them to have an open mind with it. It's not just, we're not just going there and just playing, but there are therapeutic tools, the reasons you have certain things in your room, there's a purpose for each of those. And it is to give that kid that safe place where they're not judged, that they can just feel free to explore feelings or express feelings, and they'll learn new skills kind of in a safe place. So it really does help benefit them. There's a lot of research on it. So maybe if they have any questions, ask any of our therapists here. Look online at, you know, Play Therapy Association. There are a lot of good resources.
But like you said, I've heard that a lot too when I've been working with children. The parents are like, you know, they love coming here because they love just getting to go back and play. It's like there's a lot of value and there's a lot of therapeutic work that's happening while we're playing with them. So thank you to Michelle for the time today, just talking a little bit about play therapy and some of the modalities that we use and the things that are going on with children that present for counseling that we use play therapy for. And we hope you will just follow us on some of our other Hope Talks episodes. Have a great day.
Thank you.
Thank you for watching Hope Talks. We hope this information was beneficial for you. Please be sure to check out our other videos. And if you would please like the video and subscribe to our YouTube channel, we would really appreciate it. Thanks so much and have a blessed day.